Hey guys, it's me Aditya and I'm back again with another video. And this time, as you guys can see, we have Afrin Tarannum. Hi Afrin, how are you? Welcome to the show.
I'm good. How are you?
I'm really good. All right, so guys, today's topic is Afrin is working in aged care sector and she's working as a team leader. So she will possibly guide us with a few steps in getting jobs and how her journey is in this particular field. So I'll hand over to Afrin.
Thanks, Aditya. Thanks for having me. So let me tell you something about myself. I'm originally from Bangladesh. I came in Australia in 2015. And then from then I am working in aged care sector. So I started my career as a PCW and then eventually with the ladder, like I'm working in Darwin as a team leader. Um, my educational background is back home. I did my bachelor in medicine and surgery. So I'm on the pathway to getting my GP registration in Australia. But when I came in Australia, like you always look for something like a part-time job, just to be comfortable with your living cost and everything. The main reason behind my career to choose like in aged care is like I wanted to do something in my field so that in future when I'll have my registration I can have some experience, little bit experience about healthcare. So out there, if you are coming fresh in Australia, like you don't know that where to work, you have no idea that which sector will be suitable for you. I'll tell, if you are like back home, if you are a nurse or doctor or anything like healthcare related job, it's a very good industry to work with.
All right. So you have used a lot of terms like GP and PCW. So can you just guide our viewers like what is PCW, PCA, and all these particular designations, and how like easy or is it difficult to get a job in like Australia as a whole? And we are right now, guys, sitting in Darwin, so she'll possibly aim at Darwin as a regional area. So is it easier to get a job in regional areas or the bigger cities? Handing over to you.
Thanks, Aditya. So in healthcare sector, particularly in aged care, I'll tell uh, state doesn't matter. So Darwin is my fourth state. I came here in Australia and I started my journey in Melbourne. Then I moved to Sydney, Canberra, Perth, and then Darwin.
Wow.
I have never had any problem securing my job.
Okay.
So in healthcare sector, it's a very good industry. It's booming industry. So uh, if you're working as a carer, there are a lot of jobs and it is easy. It is easier. I'll tell, it is easier like if you're comparing to any corporate job or any admin, it is easier to get into. um, yes, the terms like in aged care, I'll tell a little bit because in aged care we have three sectors. So basically one is residential care, another is respite care or home care, and then you have disability industry as well. So I'll tell you so that for our viewers it will be a little bit easier because it's sometimes like when I started my journey I didn't know that where I should go. So I used to do lots of research and everything, but it's just helpful little bit just to have little bit of guidance. So residential home is something like in back home what we think about old home, like your residential care, your residential aged care home. So all of the residents live there. So it's a long term, it's a permanent like service. In residential home, if you are a carer staff, you can work as a personal care assistant or PCA or personal care worker, uh, or AIN, assistant in nursing. And you can, if you are qualified, you can do as a PCW medicator as well. So medicator job is a little bit easier, so they will just do the medication and help the nurses. And there are RN and EN as well to oversee the whole PCWs and the care team. There are obviously admin who do the rostering, receptionist. There are kitchen staff, so chef, kitchen hand, there are laundry staff, laundry assistant,
Yeah.
and then there are lifestyle and leisure staff, so activity coordinator.
Yeah.
So you can see in only aged care home in different sector there are a lot of job. Okay.
Yeah.
So in qualification wise, like, oh sorry, I forgot about housekeeping, cleaning. Okay.
Yeah.
So a qualification wise, if you are working in the care team, the minimum qualification we require at least certificate 3 in individualized support.
Yeah.
So there is a one course, individualized support, and which that course you can actually get a job in residential home care, respite, home care, and disability
Yeah.
as well.
Yeah.
Respite is something, it's a short term. So usually basically suppose one resident have some situation and they were admitted in hospital, and then from the hospital they get assessed, so they are not going back to their home, they are going for a residential home care.
Yeah.
But in between, like, there are like probably there is no seat in the residential home, then we put that resident in a respite home,
Yeah.
so that or rehab center.
Yeah.
So in between, like, we just provide them care and just waiting for a seat in the aged care home.
Yeah.
Also there are some short term, like suppose my organization where I work, we do day respite as well. It's just like suppose some resident come and stay with us for a like 2 week or 1 week period, just to give some relief to the family or to the main carer. And then we have home care, which is like my organization. Like, I work as a part of home care team. So all of my resident, we call them consumer, like the client or consumer. So all of my consumer, they live in their own home.
Yeah.
So my team, like my support worker, they go there and they help them with all of their activities.
Okay.
So I'll tell you a little bit about the services what we provide. So basically you are looking at your PC, like personal care service. So shower, dressing, grooming, like toileting, brush, and then dressed up and everything. That's it. Second is meal preparation. So we cook for them.
Yeah.
And then if they need any feeding assistant, we serve them food, and then we feed them as well. Then you are looking for your transport, so like drop and pick, and then shopping, and then if they want to go somewhere, like suppose if you're looking for some resident who are maybe like around 65 or 70 years old, maybe have some clinical condition, they cannot drive, so then like our support worker come and then help them to get the support, like for transportation and everything. And we do the medication service as well, so assisting medication and sometimes verbal assist. So most of these home care clients, they are pretty much like independent, and then like they are okay in their life. So we just make sure that they are safe and we just supervise them. That's it. And then you have disability sector as well. So disability support worker, they are not a part of aged care, they are NDIS like providers, so they have certain goals. So like an NDIS client can be in any age, it's not about aged care, it can be like little kids and then to the aged care clients as well. So they have their disability condition. So disability support worker will basically do the same thing, like make sure that they are independent, they are safe in their home, and then just to help them with their daily living. Like that.
I guess that's a lot of information for our viewers. But yeah, I would like to ask some very descriptive questions. How would you get a job as a PCA? So let's just put some light on how we, as a student who lands in Darwin and who's, for example, studying in any university, what he should achieve or what he should do in order to get a job. As we are going through a job crisis here, and a lot of students are also suffering, as you guys can know. And so what could be like easier option, and what do you think, how much pay can they get? Is it a really good paid job? Like a student who's landing, who's 22-year-old, or maybe person who's with his family, can they do that particular job, or is it really struggling and demanding? What can you tell?
So if you're a student and then if you are compassionate and a caring and empathic in nature, I think this is the best industry. And obviously it doesn't matter if you're coming from a healthcare background or not, but like if you're someone who like to care with people and then like to interact with people, and maybe physically you don't want to do that much of hard work, so then you're looking for something like a carer in healthcare sector, support worker. If you are looking for a home care client, then basically you need to mostly interact with the client, because most of our residents, they live in their home by themselves. They do not have anyone with whom they can spend time with. And obviously when you're coming as a student, if you're coming just by yourself, like I can give you example. I came from a joint family, so when I came here in Australia, my biggest thing was like I miss my grandpa, I miss my grandma, I miss my parents, everyone. So in this industry you will learn a lot, like from the clients and everyone. And for a job, yes, obviously you will go to the website, you will apply for it. If Yes, the minimum requirement is certificate 3 in individual support if you want to work as a PCW job. But there are a lot of organization, like suppose my organization, we do hire unqualified PCAs. They do the general house cleaning. They will not be doing shower or medical appointments or medication, because that need little bit of more
Just to cut you,
qualification.
by unqualified PCAs, what do you mean? They don't need to have any qualification?
Yes. So by unqualified PCAs, what I mean that like they can just come and work, and they will just do. So the services they will do is general house cleaning, transport, so drop and pick, and shop by list, and some meal preparation.
So you mean to say that the students can get this job?
Yes, students, for our students it's really good, because we do have like permanent part-time, and sometimes we, because students always have like 24 hour, like 24 I think, something they have some work
a week or something, 20 hours
work
a week or something like that. Yeah.
restriction.
Yeah.
So yes, you don't have to have a full-time work, right? Which is good. And then obviously when you have a full-time work right in between the study breaks, most of the organization will be able to provide you that full-time work, full-time job. So it's a really good industry. And then pay wise, yes, the minimum pay, our pay depend on the hours. So it's actually decided by the government that how much you will get it. I think you will look like around maybe 28 to 30, depend on like how many year you
So
have.
roughly, if we talk about yearly package, it should be like around 40 to 50,000, or
Yes.
maybe the base.
Yes, the base.
50,000.
But there are overtime. So
And
if
then
you are
overtime.
doing afternoon shift or night shift, you are getting double, and a lot of works in public holidays. So you are actually maybe your base rate is around 28 or maybe 29, but actually you are earning more. And sometimes we prefer the students, like if someone is working like doing a bachelor of nursing, so once they finish their first placement, they can apply. So they can actually, it's not that they have to finish the course or everything. If they just enroll, they can actually work as a PCW. It's good for them, because by the time you finish your nursing degree, you already know that how the healthcare work. You already very much confident with how to deal with your like clients who got dementia, who got mental health issues, and then especially talking with the family, because that's the biggest challenge.
So do you think for students it would be really difficult for like coping up in this kind of scenarios?
No, I don't think so. Because I am in Darwin. I look after, like I almost have like 80 support worker who is working under me, and like most of the time, like some of them are from nursing background, but we do have students who are working like in accounting, IT. And it's a good thing, because sometimes like in all of the aged care provider companies, they need admin staff as well. So like even if you're doing maybe bachelor in IT, and then that like if I work as a PCA, it's actually easier to get a corporate job in that way. And obviously, like if I am doing the recruitment, I would prefer to grow my staff other than hiring someone from outside. So yes, it is good. And for the reference and everything, if you have experience, like if you work back home, it's good. But even if you don't, you can actually tell in the interview that like, okay, I haven't have any experience, but I'm happy to learn. Like for PCAs, like unqualified PCAs, you literally do not need any experience. And we do have some apprenticeship as well. Some companies provide that one, so maybe double check with your like
Yeah.
organization, that if you have that, because that's a win-win situation. You can work, you can study, and then a company will pay for it.
Yeah. All right. Thanks, Afreen. I think we have covered most of the topics. So now let's just kind of focus and reflect on your background. So just tell us something about yourself, if like which background you're coming from and which exact year did you come from. If you're not comfortable, you don't need to say a lot of things, but whatever you can just, yeah, tell our viewers and just let us know.
Okay, so I came in Australia in 2015, like around like late of 2015. So I started working in Australia, like in aged care, not in aged care industry. 2016, I worked in retail first, and then some factory work as well. I did my bachelor in medicine and surgery. So my struggle was like I used to miss my patients, like touching them and then diagnose them, interaction and everything. Then I decided that like, okay, I need to find out something where I can talk with my patients or like talk with people, and then maybe like make a difference in their life. uh, then I did my first course in certificate 3 in individualized support, and then eventually certificate 4 as well. uh, and then I used to work in Melbourne. So it's that's so I started my career with a residential background, residential home care, and then after that I worked in Canberra, worked in Sydney, and then in Darwin I worked in home care. And yes, in the meantime I worked for some disability support home as well. And then, as you know, that like at the moment I'm working in a team leader position. So I finished my diploma in leadership and management as well. Yes, that's it.
All right. Okay, that's a lot of experience, Afrin, and I think you have covered most of Australia. The only thing I think just one or two cities left, right? Okay, all right. So let's just talk about lessons and reflections. Do you have anything which you regret about, or anything which you would like to put some more light that you like in Australia as a country, or do you recommend people maybe trying some other country like Canada, since you also have some relatives in Canada or somewhere else? If you just do a normal comparison of people coming from any backgrounds from India, Bangladesh, Pakistan, anywhere, what would you like to tell them about Australia as a country, like in terms of settling in and a normal base rate, wage, and this kind of like your kind of background, what they can achieve?
In Australia, I actually don't have that much experience in Canada, because I like from Bangladesh, I directly came to Australia. I haven't been to in other countries, not even India, not anywhere. Um, so, like I will tell that if you're working in a healthcare industry, like inside the Australia, doesn't matter which state you work, it's really good. It's really good, and you will be satisfied with your job. But depend on that if you are someone who is like a people person.
Yeah.
um, and pay is really good as well. Like if you are thinking of like if you are working as a student, or if you're coming as a like partner visa, then you have full-time work, right? So you can basically support your partner for the tuition fees and everything as well. um, so far in Australia, I have been like most of the states, and people are good. People are really good, and then they respect you. Work culture is really nice, and I think in healthcare, actually, like it's good. It's satisfying. Yes.
That's really, really good to hear. All right, guys, let's time to wrap up. And don't forget to share some reviews about our first podcast. And if you have any questions for Afreen, just let me know and push me like a message, or you can comment on this video. And then I'll possibly, if you need her to come again, then we can again schedule another video, and just let us know what exact type of questions or anything you guys want to ask from her, since I think she has covered almost all topics. It's just like the information left, like you guys can like achieve those information, like those courses and everything. I think there are a couple of institutions around here, and if you really need more like information about those courses, I can have someone from those institutions come and do a podcast with us. So just let me know how this is, and like and subscribe. You would
Thank
like
you.
to say something?
Yes, thank you so much, Aditya, for having me. And obviously, like in the ad in Aged Care Safety and Quality Commission website, you will have all the information. And if you need anything from me, just like let me know, and then just write in the comment section. And subscribe these channels. Thank you.
Thank you. Thank you, Afrin. Nice meeting you.